Goodbye, Canada. Hello, world-class healthcare.
Hi there, everyone, and welcome back to Travel and Explore Now. We've just put out 2 videos of Goodbye Canada, and we've had a lot of questions, a lot of comments about healthcare. So we're going to tackle healthcare today in this video. I think you're going to be really surprised at what private care actually costs and the quality of service that is there. You know, Canada has really changed. It's not what it used to be.
Canada at one time was the hero of healthcare worldwide. You don't have to spend very much time listening to the news to hear all the horror stories now, though. For starters, a large percentage of Canadians can't even find a doctor. In British Columbia, where we are from, as quoted by the Vancouver Sun, nearly 1 million people don't have a doctor, period, which is 1 in 5. When I moved to the island, I went for years before I finally secured a doctor. I felt like I'd won the bloody lottery. It seems that no matter what you want, there's always a long wait involved, and then the chaos in emergency departments in the hospital themselves. You know, we could go on and on and on, but let's just say Canada's healthcare system is in crisis.
It's really not what it used to be.
You know, for us, the healthcare situation in Canada, to us, it's just really sad. And we no longer trust it. So we decided to go and do something about it. And today, we have global healthcare. We can go basically almost anywhere in the world and we are covered. So we get the luxury of enjoying travel and the safety net. We also have access to the best healthcare going, and the hospitals are phenomenal. We can't wait to show you this, and it's affordable and you'll be amazed at the quality. We also have some stories from fellow Canadians in this video of some of their experiences in the hospitals around the world. So please stay tuned and let's get to it.
When we talk to people, there seems to be a lot of confusion around the difference between medical insurance and travel insurance. You can get travel insurance from 1 day to 6 months to a specific location. When they're done, they're done. Most travel insurance does not cover multiple location travel, and if they do, you have to specify which countries you will be visiting. We needed something that covered us 365 days a year, and we wanted the freedom to go wherever our little hearts desired. That is why we went with medical insurance. Big difference between the two. Make sure to do your research. Yeah, I should have taken my helmet off probably. But,
I think you're gonna sleep in that today.
Captain Jill. Jill, did anyone tell you you're heading right for the reef?
No!
Yes. Where's the steering wheel?
It's right here.
Well,
So we needed to find healthcare that would be tailor-made for our needs.
What are you gonna do about it?
Well, after a lot of research, we decided to sign with Cigna. Our plan with Cigna offers an annual benefit limit of $1 million USD worldwide, excluding the United States. Also, it includes international evacuation and crisis assistance, plus a $1,500 deductible USD. The annual cost for Randy and I is $7,728 USD. This will vary on every single person, and it's based on your age and also any pre-existing health conditions.
after a little bit of negotiating, we had Cigna include the wellness program. This is all about preventative health. This covers thorough annual checkups, different types of cancer screening, and a myriad of other tests. This is all included for absolutely no charge. and you do not have to reach your deductible to claim this.
And our healthcare has never been better. Like seriously, every year you get a wellness check. And we were in Kuala Lumpur and we had our wellness check done there. I had a pap test, I had a pelvic ultrasound, I had a mammogram, I had echocardiogram, I had a stress test. I met with the cardiologist. And if that wasn't enough, I had a hearing test, an eye test, and I met with a dietitian. And at the end of it, you end up meeting with your doctor for an hour to go over all your results. And this would have taken me probably years to achieve in Canada. So it's never been better.
So all our testing was done at the Prince Court Hospital in Kuala Lumpur. The hospital is magnificent. It's like nothing else that you'll ever see. You know, Randy and I were just stunned by the quality and the efficiency of these hospitals. They blew our minds. They are truly leaving Canadian hospitals behind. You know, I think Canadians have just such a misconception of what hospital care is like in other parts of the world, whether it's Malaysia, whether it's Thailand, Singapore, Mexico. The hospitals overseas, they are so progressive and forward, it makes our system look pathetically bad. Here is fellow Canadian Terry Brown and Igor from Calgary with their story and experience from the healthcare system here in Cabo San Lucas, Mexico. This healthcare system saved both of their lives.
Regarding health care that we've had here down in Cabo in San Jose, and I just want to tell everyone how amazing the doctors are here and how compassionate they are and how efficient they are, and the care that we got was top-notch. And my husband, he ended up having an issue with his lungs, and after not getting the right diagnosis back in Alberta, he was sent down here saying he had COPD. He didn't have COPD, he had a terrible lung infection. The left side of his lung was 45% capacity. Now, why the lung specialist didn't catch that back in Canada, I do not know, but within 30 days after we got down here, the lung specialist did catch that, and he ended up getting x-rays and a CT scan, and then he had to go in for a bronchoscopic procedure where they went in and cleaned out his lungs, and he was like a new man. They saved his life. Then I started having issues. I started having breathing issues and excessive sweating issues and feeling dizzy, and my GP, who I want to say I do love my GP back in Canada, he referred me to a cardiologist, and it took 6 months to get that appointment. And I was getting ready to come down to Cabo, so they were able to fit me in, and I had an ECG, an echocardiogram, and a 48-hour monitoring. But the only reason I had the 48-hour monitoring was because somebody canceled. Otherwise, I would have had to wait 6 months for that. Anyway, I was told to just go down to Mexico, that I had severe bradycardia and that I definitely needed a pacemaker, and they had no idea when I would be able to get a pacemaker. But if you had an issue when you're down in Mexico, just take an ECG on your watch, Apple Watch, and send him a PDF. Not sure what my cardiologist could have done with that while I'm, laying somewhere having an attack, but is having heart issues. Can you refer or recommend a cardiologist? Well, within 5 minutes, and I'm telling you, within 5 minutes, he had an email back with the name of a cardiologist, and we emailed the cardiologist, and he said, "Can you send me your tests?" And I did. Once I sent him the tests, he said to me, "I need to see you right now at 5 o'clock. Like, just get down to my office as soon as you can." So I went to his office. He just looked at me in shock and said, "I cannot believe that they sent you down here without a pacemaker." And I said, well, they told me it was going to be months before I could get a pacemaker. And I said, should I go back? Should I wait? He said, I wouldn't make a terrorist wait to get it. Well, within 48 hours, I had a pacemaker. And that was 4 years ago. And now I have to tell you that I walk probably anywhere from 1,800 to 2,000 kilometers during the 6 months that I'm down here. My heart is beating perfectly. I still come down and I see my cardiologist every year, and I want to tell you that we are so grateful for the lung specialist and the cardiologist that has basically saved our lives. And I do want to say, though, I don't want to diminish the great care that some people are getting back in Canada, in Alberta, or any of the provinces, but there's people that are falling through the cracks, and I want to be an advocate for them. So if you can, share your story with me or send it to Jill and Randy, and I would love to hear what's going on, because when I get back, I am going to start working very hard on helping people.
Big thank you to Terry Brown for sharing her story and Igor's story with us here on Travel and Explore Now. There's tons of stories like this and more every day. Some make the headlines and some don't. So we'd love to hear your story, and we just want to show you an option that is available, because the healthcare, when you think about it, is affordable. And to have a healthcare that you can trust and you know is there for you, it's unbelievable how that feels. I feel like we can travel with confidence and live with confidence that we are taken care of.
I know a lot of people will be thinking $7,728 US. Wow, that's a lot of money for healthcare. But we have reduced our taxes. We have reduced our cost of living. Our whole cost of living per month is less than $5,200 Canadian for the two of us. And we are traveling the world. We are having the time of our lives.
So, if you're interested in learning more about Cigna, we will have all the contact information in a link below. If you do contact them, make sure to mention that you are a Travel and Explore Now subscriber. Cigna has said they will do everything in their power to give you the same discounts that we received.
Don't forget to please subscribe, like, and share. And you can follow us on Instagram, Facebook, and LinkedIn as well. So please see the link below. Bye, everyone.